program you're about to see, Strategies for Health After Breast Cancer, delivers information that cancer survivors need to improve their quality of life and reduce their risk of cancer recurrence. It's been produced in a partnership between the Sisters Network Incorporated, a national African American breast cancer survivorship organization, and the University of Maryland School of Medicine. Members of the Sisters Network and other breast cancer survivors are featured in this program. They came together to share their stories about the challenges they faced in getting treatments, their special needs as African Americans with breast cancer, and the changes they made to improve their lives. My name is Kelly Sweet, and I'm proud to be a part of this important program designed for African American women with breast cancer and the health professionals who treat them. This program will teach you how to make a plan of follow-up care that meets your own medical needs and lifestyle. The Women and Doctors and Strategies for Health present the guidelines that you need. The goal is to help you become an active partner in your follow-up care.
First of all, I would recommend that African American women get in tune and know their own bodies. Go for treatment, be assertive, pick their own doctors, research their backgrounds, and if they don't like them, see someone else. But stand your ground.
I know that you go to church almost every Sunday. How have you been doing?
Oh, I've been doing good.
Still able to go to church?
Yes, I go to church every Sunday. Faith and prayer means a lot to myself.
Faith is what brought you here, okay? And the prayer is actually complimenting us and helping you and treating you for your breast cancer. So it doesn't take the place of medication, doesn't take the place of the surgery or the chemotherapy or radiation, but it helps you to get through this time and to make you stronger.
The information we present in Strategies for Health is based on scientific evidence from the Institute of Medicine. Since 1970, the Institute of Medicine has served as an advisor to the nation to improve the health of people in our country. The Institute of Medicine guidelines for survivorship care will help you get the quality of health care that you need as a cancer survivor.
The Institute of Medical Guidelines is most important to patients to get a better understanding of cancer, how it affects them, how they can be treated, or how the cancer can be treated, and overall protocol that they're going to go through to get better. Healing process, treatment process, and what they should basically do after they finish all the treatment. There's another life after all of that.
While each woman's plan of care will be based on her unique medical and lifestyle needs, it should follow 6 basic guidelines. Get a summary of your medical information, treatments, and side effects. Understand your risk of recurrence. Make a schedule for checkups and screenings. Stay at a healthy weight through diet and exercise. Ask questions and express concerns to your doctors, and get social support. These guidelines are particularly important for African American women because they are often diagnosed with advanced breast cancer and have higher rates of recurrence. Lack of access to health care, poor quality health care, and having multiple health problems contribute to disparities in breast cancer outcomes for African American women.
So there are a lot of people, about 17% of Baltimore City residents that are in this 40 to 64 age group don't have insurance. If you can't pay your rent and you can't pay for food, you're not thinking that you can pay for a mammogram or a doctor's appointment. And a lot of times you're trying to take care of your kids and make sure that you can take care of your household before you take care of yourself.
I think the reason, because we don't have access to a lot of things. Because of insurance, a lot of women don't have insurance, and the part of the cities that we live in, and the culture, and we miss out on a lot.
If they don't have health insurance, they don't know where to go. And so they just deny the fact that there's anything wrong because I can't pay for it. So if I can't pay for it, why do I need to find out that I have an issue?
Family responsibilities can also get in the way of women getting the health care that they need.
The disparities are that we tend to put ourselves last. We don't think to take off. We put off that doctor's visit for, we'll do it next month or we'll do it next year, because our main focus is taking care of our family. If I take off a day, am I going to be docked that in my pay? Can I afford to take off a day? Dealing with the actual diagnosis, dealing with the treatments, and then having to go back to work. I had to go back to work because financially I could not afford to be off of work. I went to several organizations to try to find some type of assistance. I went back to work 2.5 weeks after having major surgery. And I worked as I went through 8 doses of chemo, radiation, and everything that was going on with my mother.
Education level and knowledge of the healthcare system play a role in breast cancer for African American women.
You really don't know what to ask when you go to the doctor, so you might not get the medical attention that you are seeking.
Could I have been diagnosed sooner? Could we have prevented it? Possibly. I don't know. But delaying because, for whatever reasons, family, we put other priorities ahead of ourselves because we are the backbone of the family.
To summarize, we've heard that the following factors contribute to disparities in getting the health care that African Americans need to survive breast cancer. Income, access to health care, family responsibilities, level of education, and navigating the healthcare system. As you will see in a moment, many African American survivors report that they haven't received a follow-up plan of care from their doctors. This is important because African American women are less likely to survive for 5 years after breast cancer. Having a plan improves your chances.
How many of you received a written follow-up care plan from your doctor?
I got a plan.
No.
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 Yes.
No. So how many is that? 2 of you out of 10?
He did not give me a written plan. He didn't say anything about changing my diet or anything at all. He just said, you go home, eat normal, and just enjoy life. And come back for your yearly checkups.
Wow.
I didn't receive a written report after my surgery as far as what procedures I would have to go through. Like I said, the only thing that I received was my lab result. Where is the standard? How do we determine what that standard of care is going to be? How long should you be monitored? How long should you take your tamoxifen or your Remedex or your Femara, whatever medication that you've been prescribed after your treatment? I think that's what we need to focus on, standardizing that, because right now there is no definite time frame in terms of how long you should be followed, how long you should continue to take your medication. Like you said,